presentation is from the Franklin County Board of Developmental Disabilities. At this point, I'll turn it over to Jed Morrison, Superintendent and CEO.
Well, thank you, Zach, very much, and good afternoon, Commissioners. Thanks so much for the opportunity to present our budget for 2022. As Zach said, my name is Jed Morrison. I'm Superintendent of the Board. And I'm joined by Dot Yeager, who's our Chief Business Officer, and Jennifer Schuneman, who is our Controller, and Rebecca Love, who is our Director of Early Childhood Education. Simply put, when you talk about our organization, our mission is simply to help children and adults who have developmental disabilities to live and to learn and to work inclusively in our community. Within our agency, we support over 10,000 individuals at any one time, and as Administrator Wilson pointed out earlier, about 20,000 or more over the course of a year, providing services directly and through contracts with different organizations such as Nationwide Children's Hospital, Head Start, Easter Seals, Creative Housing, Heinzerling Center, Nisonger Center at Ohio State University, Wexner Medical Center, Goodwill Columbus, Arc Industries, and many, many others. Lifetown is also one of our contract agencies. Everybody that we serve within our agency has what's called a developmental disability. And what that really means is that they have a disability that originated in their developmental years or prior to the age of 22. It also means that their disability is expected to last indefinitely. It's not a broken arm or a broken leg. It's something that's expected to last indefinitely. And their disability results in significant challenges in areas such as intellectual development or mobility or behavioral challenges or communication. We will serve people for a lifetime. In fact, our youngest participants are referred generally at birth, and our most senior individuals that we serve are in their 80s or 90s. Their disability originated in the developmental years, but we will serve them for a lifetime in many cases. We directly provide or support early childhood services, school services. We have a transitional program for 14 to 22-year-old kids, adult employment, vocational services, residential services, transportation services, programs like Special Olympics and many therapies, and lots of other special services such as our Service Coordination Department, a very important department within our organization. Of course, this budget will provide continued support of all of these services. We are accredited by the Ohio Department of Developmental Disabilities, and we have what's called a 5-star rating from the Ohio Department of Education. It's step up to the quality rating. It's the highest rating that you can get. And our board is comprised of 7 individuals, 5 of whom you appoint, the commissioners appoint, and 2 are appointed by the probate judge. And our proposed budget for the 2022 years is about $243.5 million. And this is very consistent with our long-term levy plan to stay off the ballot until 2028. We are very committed to that. And I will say, in talking about our budget, that we're very appreciative of the support that we've received and the guidance from Rachel Buskey, our budget analyst, and Zach Talarek, as you just talked about the good work that Zach and his team do. And Administrator Ken Wilson has been very helpful providing guidance and support with the budget process and a number of other things, frankly, throughout the year. We employ close to 650 staff, including teachers and therapists and service coordinators, bus drivers, staff who provide direct services. And I am a bit biased, but can tell you that we have an outstanding staff. And you have visited and seen some of those staff. You have complimented us on that, which we really appreciate. And I think they are first rate. We just finished our Combined Charities campaign. I know that the Commissioner's Office was very much involved with that. And proud to say that we again raised close over $60,000, more than any other county agency. And so we were very proud of that. And throughout our organization, we have developed many partnerships with different community organizations who we fund. We provide funding to those organizations to provide services that help us to meet our mission. In addition to general laws related to public services and civil service and those kinds of things, we are also governed by rules of what a couple state agencies, the Ohio Department of Developmental Disabilities, the Ohio Department of Education, and then certainly the Ohio Highway Patrol, the Ohio Department of Medicaid, and some others. We continue in our role in this community and at this time with the pandemic to be challenged by COVID, but are pleased to report that our staff and community providers and those we serve have really responded quite well. In addition to our staff, we have the opportunity to support approximately 150 different active providers and close to 300 independent providers who support individuals in their homes or with transportation or in employment or day programs for adults. We work very closely with an awful lot of different organizations. They are not employed by us, but we contract with them, and they are supporting people, in many cases, those day-to-day, on-the-ground services in people's homes. And as with other industries, these community providers have been challenged with workforce challenges, frankly, particularly direct service support professionals, people that are working day-to-day with individuals in their homes. And these positions, for the most part, are funded through Medicaid with federal, state, and local dollars. We commit within Franklin County, and the commissioners, I think, would be very proud of this. We commit close to 80 million in match dollars for these Medicaid services. And that $80 million generates over $150 million in federal Medicaid dollars. So when you add that together and you throw in some additional money that is used as match from the State Department, our Franklin County taxpayers and citizens are getting over $250 million in Medicaid services for an investment of about 80 million of local funding. So our 80 million draws down that additional money, totaling about $250 million of services for our people here, right here in Franklin County. It's more than any other county in the state, and consistent with what Commissioner O'Grady was saying, I think we have the finest, again biased, I think the finest set of services provided here in Franklin County. Thanks to the good work of our staff, our direct services have been provided all year despite the pandemic. In fact, we actually started providing services directly in our early childhood program and in our school program back a year ago at the beginning of the school year. We continue to provide door-to-door transportation for our preschool and school-age children. And we are back really in terms of enrollment to our pre-pandemic enrollment levels at our preschool and early intervention programs and our school program. So we're, I feel, doing very, very well. Becky Love is our Director of Early Childhood Education and does an outstanding job. And I've asked her if she will just provide an update on her services. So I'll turn it over to Becky for just a little bit here.
Okay, thank you, Jed. And yes, it has been quite an, I would have to say, interesting year. Our department serves children ranging in age from birth to 6. Some children are served in their homes, and older toddlers and preschool age children are served in one of our early childhood centers. We have 2 of them, one on the northwest side of Columbus and one near the airport. We work in partnership with a number of organizations, including Head Start, as Jed earlier mentioned, the YMCA, Ohio State University Medical Center, and all 16 school districts who refer the children that we serve. We also contract with Easter Seals, Childhood League, Dahlberg Center, Nicehonger Center, and the Nationwide Children's Hospital. In our centers, we serve several hundred children in inclusive classrooms, meaning children with and without developmental disabilities. They learn together. We serve a very diverse group of children, which are representative of our entire community. The school year we went This school year, we went back to serving all children on a weekly basis. Last year, due to the pandemic, we served a number of children, but we had to accommodate the number of children who were together. And due to that, we served half of the children 1 week and the other half the next week. This allows us to serve up to 18 children per classroom. Some children have disabilities or delays and others do not. We call this an inclusive environment. All staff continue to wear masks now. We have disinfectant stations, related protocols, social distancing is practiced while possible with preschoolers. Temperatures are taken before children board the bus for those children who ride the bus. Children who are self-transported by their parents, temperatures are taken before they enter the building and into their classrooms. Plexiglass dividers remain that are used in some cases. Outdoor spaces are prioritized, and fortunately, we've been able to organize them in a way to extend the classroom to the outdoors, and children spend a large amount of their time out there, weather permitting. It's very different, but our teachers and therapists have made it work. It's been difficult as well, but also manageable. We've had a few children who have contracted the virus, requiring quarantine for some. We are not aware of any hospitalizations with our students. Some are able to wear masks, while others certainly are challenged with this and are not able to do that. So despite the pandemic, we have been able to still see children and support their education. And just to wrap up, let me offer a word of thanks to the commissioners for your support and your visits. We enjoyed the recent visit of Commissioner Crawley, and of course, past visits from other commissioners, Boyce and O'Grady. With that, I'll turn this back over to Jed.
Thank you, Becky. And I mentioned earlier that we have a 5-star rating in what's called Step Up to Quality, and the credit for that goes to Becky and her team and the partnerships that we have with so many different organizations here in the community. It's very impressive. So thank you, Becky, very much. I thought I would also just offer some comments related to other initiatives as a result of the pandemic. Within our agency, we established a distribution center of personal protective equipment for staff and for residential providers, many of those 150 or so active providers in the community, with sanitizer and mask and other supplies. We established a program with private providers to help fund unreimbursed costs when they had staffing shortages due to the virus itself. So this was kind of a unique way to support them. Even though they're Medicaid providers, we were able to establish that program. And early on, we established a contract with a provider in our community. The provider's name is Open Door, and they actually provided for us serving as an isolation and quarantine center for those individuals who might have been served by small providers who had staffing issues during the pandemic as we know it today. We've also, our service coordinators were able to revise program plans to allow for additional Medicaid funding to providers who were serving people more hours during the day to support special services. For example, we had some people that needed to be at home more because some of the group employment or group services during the day may not have been available during part of the pandemic. And then they also had different requirements in terms of ratios and those kinds of things to maintain social distancing. So we had to adjust their plans, and our service coordinators did a very nice job with that. One of the most important efforts of this past year was our effort to get vaccines for those that we serve and staff. Individuals with disabilities and certain direct staff positions were prioritized by the state, which was very welcome to us. This happened in January. We worked with both the Franklin County Health Department and the Columbus Health Department and Children's Hospital to set up a number of clinics. We estimated that over 11,000 individuals were eligible for this. And our health departments, I would say, and Nationwide Children's Hospital were just incredible partners with this effort, just incredible. And it was through a couple months, we were able to vaccinate thousands and thousands of individuals. And additionally, early on in the pandemic, we helped to coordinate alternative staff assignments for providers where certain adult services staff members were shifted to the residential field to avoid layoffs and to fill the needs that we had in some of our residential settings. So very pleased that we had the flexibility of staffing from different organizations, and we helped to coordinate that effort. We have also had to make a significant investment in technology, sanitizing materials, as Becky referred to, adapting facilities to support remote and in-person services. The pandemic has also resulted in some funding shifts for us for this year and next. We expect this to continue into 2022. We've been able to redirect some of the funding to providers to help with wages with the savings we received due to what's called efMap. It stands for Enhanced Federal Medical Assistance Percentage from the federal government. And basically, the federal government provided an increased share of the Medicaid cost, which reduced our percentage of share or share. So we didn't actually receive money from the federal government, but we saved because they were paying more of that the share, and that was very welcome to us, and we have been able to share that not only for some of the special programs that we're doing, but also with providers in the community. All in all, I would say that our staff continue to do excellent work in response to the pandemic, and we expect that to continue into 2022. If I could, commissioners, I'd like to offer just a couple comments regarding our work that links to the commissioners' Rise Together blueprint. And as a part of this, I'll highlight our performance spotlight, which really relates closely to housing and residential services. And first, let me say that we appreciate the commissioner's leadership related to the blueprint. Since the commissioners have adopted this blueprint to reduce poverty, our board has adopted several initiatives. We did increase the starting wage of all regular staff position to a minimum of $15 per hour. We supported a significant allocation of funds from our enhanced efMap, as I described earlier, to support an increase in direct service professional wages. And these are generally people that are not in high wage positions. They work for providers in the community. They are working in some cases morning, afternoon, or evening shifts with people in their homes or in the settings where they live. And we felt it was very important to support that. We continue to invest significant dollars also in housing and residential services for people to live in safe housing in the community. You may be familiar or recall that we have an organization called Creative Housing that we started back in the early 90s. And this particular organization has over 400 homes in the community where people live. And they also operate a rent subsidy program for us, serving over 600 additional people. Rent subsidy, the way that our rent subsidy program works is that the subsidy covers the fair market cost for apartments or housing that exceeds 30% of a person's income, of an individual's income. So it's very helpful, and it's serving and supporting a lot of people. The housing and residential initiative in our performance spotlight this year is certainly what links, one of the things that links very closely to the blueprint. And we're proud of the fact that we are able to support people in this way so they can contribute to the community and be included in neighborhoods throughout Franklin County. Also like to take just a minute to offer a few comments related to our efforts to support diversity and equity and inclusion. Our agency, since its inception, has worked hard to support inclusion and equity of all individuals, regardless of disability in our society. We continue to support this in education, offering inclusive preschool services where children with and without disabilities are educated together, like Becky just described. We continue to work hard to support individuals to secure jobs in the community. And as I described, we work hard to support people with housing options in the community, so they are a part of the community. And as an example of our employment efforts, ARC Industries serves several hundred individuals who are employed in the community, including many who are cleaning both state office towers every evening. Actually, over 100 individuals are employed there. In addition to these efforts, which are at the core mission of our agency, this past year we have continued to place increased emphasis on our efforts to prevent any forms of discrimination. Some specific actions include, number one, following the lead of the commissioners, our board adopted the resolution declaring racism as a public health crisis and also published the action widely with staff and providers. We established an equity committee. In fact, it's co-chaired by Becky Love and Gwen Kinsel, who's our EEO coordinator and our legal counsel, to research. This committee, we asked to research and offer suggestions, proposals on how to eliminate or respond to any forms of discrimination. The committee established several subcommittees to look at policies, recruitment and retention and training. I think there are over 55 people on the committee, who are broken down into different subcommittees. We established a training center this year with monthly training sessions coordinated by our equity committee on a variety of topics. And as I've mentioned previously, we have financially supported wage increases for low-paid positions in the provider community, specifically the direct service professionals in their homes. And we continue to our partnership and services in the community for individuals and organizations that are reflective of the entire community. One example of this is our relationship with Head Start and the people we jointly serve, and our connection through Head Start to the Somali community here in Franklin County. And I am happy to say that thanks to Administrator Ken Wilson and Commissioner Joe Mazzola, we will be sharing the good work of the commissioners related to eliminating racism and the public health crisis initiatives that you all have adopted. They are going to be sharing that throughout the state at our annual convention in early December. And I will also say that Administrator Wilson was very helpful and has been very helpful in presenting to our board directly. And I also appreciate the commissioner's recent board appointment. Samuel Davis was recently appointed to our board, which has added to our board's diversity. And we look forward to your next appointment to replace Linda Craig. Unfortunately, Linda Craig is term limited. She has been an outstanding board member and served on our board for 12 years. We are sorry to say that in January her term ends, and so the commissioners will have another appointment there. And we appreciate your support with our board appointments. And finally, I just would like to ask Dot Yeager, who's our Chief Business Officer, to provide you with a high-level review of the budget. And Dot can do that best. Dot?
Thank you, Jed. I'll provide a brief overview and would be happy to answer questions. On the revenue side of our budget, we basically have four main sources of income. Our two levies. We have two 3.5 mil levies, one that is continuous and the other is a 10-year levy that will expire in 2028. As Jed stated earlier, we are committed to staying off the ballot until this levy expires. We receive funding from two state departments, the Ohio Department of Developmental Disabilities and the Ohio Department of Education. And our fourth major source of revenue is Medicaid funding, primarily for service coordination, case management services. On the expenditure side, our funds are allocated to several major programs. First, we commit significant resources to the early childhood and school age programs that we operate directly, which also includes transportation services. The majority of this expense is for staff, including teachers, therapists, bus drivers, and support staff. Another major expense category is for our service coordination department. We have close to 250 service coordinators, or what we previously called case managers, who coordinate service and supports for children and adults. This includes securing Medicaid waivers that help to fund services in the community. We have increased staffing in this department to assist with efforts to reduce what was called our waiting list and is now referred to as our current needs list per changes in state rule. Our staff has done an excellent job managing this. As Jed pointed out earlier, we budget approximately $80 million in Medicaid match. This generates over $170 million in state and federal dollars, which flows through the state to several hundred residential and adult services providers in our community. And a significant portion of our budget funds other organizations who help us to fulfill our mission. Some of those organizations are Nationwide Children's Hospital, Goodwill Columbus, Creative Housing, Nysaunger Center at OSU Wexner Medical Center, ARC Industries, Alvis House, Boundless, formerly Franklin County Residential Services, Easter Seals, Childhood League, and others, including several independent transportation providers. Our board's philosophy has been to have a mix of services, some provided directly and others through contract and good partnerships. To fund these services, our proposed budget is approximately $243 million for 2022. Thank you.
Thanks, Dot. And again, I would just reiterate that Dot Yeager, our Chief Business Officer, and Jennifer Schoeneman and several other staff have really done an excellent job and really keep us on track. The way levies work, you have to really plan for a levy cycle rather than just 1 year at a time. And so their work on this, coupled with the support of Zach and Rachel and Ken and the other members of the commissioner staff, have been very helpful in keeping us on track with our long-term levy planning. So I would simply, with that, just say on behalf of our board, we thank you very much for consideration of our budget and your support of our services. You know, I think some would say that a reflection of the community is sometimes best determined by how the community supports those who are in need. And thanks to our excellent staff and the support of those we serve and their families, we think we're fulfilling the needs of many individuals and their families. And we thank you, the county commissioners, for making that possible with the support of the budget. And if I might, I just might offer another word as we close out our presentation. And that is just simply a thank you on behalf of our staff for the leadership that the commissioners have provided. It's really, when I tell my colleagues across the state that our commissioners have hosted regular meetings, generally with over 100 or so on the calls, ever since the pandemic started. I know they started at 7 days a week initially, and they continue to this day, and every periodic we have the meetings. That is remarkable, and it really has helped us as an individual agency to learn from others and maybe to share with others some of the things that have worked for us. And I might also say that the news this morning of the pay program, the special pay program that the premium pay program that the commissioners are looking at, has certainly been very well received by our staff, and we very much appreciate it. Your leadership and support of our services, your references in meetings, and asking how our staff are doing, and your staff support in many ways really does make a big difference to the individuals that have developmental disabilities in our community. So we really thank you very much. So with that, we are happy to answer any questions that you might have. And again, thanks so much for the opportunity to present to you today.
Commissioners, do you have any questions for Jed?
I
I have a
do.
question when the commissioners are done,
Go-
Zach.
Go ahead, Deputy Administrator Bivens, because I'm still looking at some information to formulate my question. Okay.
The only thing I was going to ask, Jed, and I apologize, I was looking at all of you all's information, and I realized we have a human services roundtable that focuses on having conversation on same clients that we're all working with, and wanted to see if I could reach into you to talk about putting a representative on that roundtable.
I'm sure we would be very willing, Joy, to participate. Absolutely no problem.
Good.
We would sometimes have folks in common, and so happy to participate.
Yeah, good. It would
Happy
particularly
to.
for our family stabilization unit for the kids in the juvenile justice courts. So that would be really, really good. And possibly we can make referrals and they can understand your system even in a greater depth. So thank you.
Yeah, I think we do have some people involved already, maybe not in that specific committee, but working with folks that might have some particular challenges, multi-system youth, and we've got some priorities in that area this year as well. So no
Awesome.
problem.
Thank you, Jed.
Thank you.
So my question was around how many of our neighbors are being serviced in total. So I'm looking at the information that was provided for the 2021 recommended budget, and I could see for at least the residential program under the performance spotlight for 2021, it was a little over, I guess, 7,231. But I'm just wondering across all programs, about how many of our neighbors do you provide services for?
Yeah, that's a good question, Commissioner. And we at any one time, we are serving about 10,000 individuals. But when we add people that we serve throughout the year, the comings and goings of folks and people with contract agencies and different programs, we touch at least 20,000 over the course of a year. So we have a pretty significant reach, and that's individuals who have developmental disabilities. If we were to really extend that, we also are supporting their families, which would be even more. So it's a pretty significant reach.
And then can you tell me around how many individuals are Medicaid waivers?
We have right now about 6,000 have the Medicaid waivers. We anticipate it's just a little bit under 6,000. We anticipate that number growing to about 6,200 by the end of next year. And these are people that receive support through the waiver, which is basically a funding source for services. And so they get residential help, they get employment help, they get transportation help, they get a day service support. It's that kind of funding. And so we have more actually than any other county in the state. And that has, as I indicated earlier, been able to generate over $150 million in federal money coming to Franklin County rather than going to California or somewhere else. So we think it's quite good.
And then one final question, and Ms. Love may be the one who could answer this. For the children that are in like the Head Start programs and those who may be identified as differently able, like what typically, if they are identified in the programs that are in where you are located, is it typical for as they move out of the program, out of Head Start or, Term 5 or whatever, that they would continue services through the BODD? Like, what is that relationship like as a contracting partner?
The children who are enrolled into our combined programs are enrolled through our agencies.
Okay.
So Head Start children who are enrolled meet the criteria for Head Start.
Mm-hmm.
Income eligible primarily. And then, of course, the children who are enrolled with the county board have developmental disabilities that have been identified. Now, occasionally, because the Head Start children are at risk, they may have some developmental delays as well that have been identified through the partnership. Those children then are referred through their system. We coordinate with that and through the district. If they go to the district and are identified with developmental disabilities based on ODE guidelines, then they could come to the other side of our program and be served as children with disabilities if we have the space for that. So the intent is that we maintain the 50-50, that the children who are enrolled in partnership are truly children who have been identified and children who have not. But of course, the kids who may be marginal have the benefit of the services that we provide. So they may never be identified because they've received the stimulation that they would otherwise not get. So there's that benefit as well.
Okay, good. I was curious about the continuity of care, because I know that sometimes children can be identified with some delays, that may not be identified at birth, but
Correct.
if at all possible, could move on to the other side and continue with in a space, in a place that's familiar to their families.
And that, yes.
Yeah.
Yes.
Okay. All right. Great. Thank you. Did you have? All right. Thank you. I appreciate it.
Thank you.
Jed, I don't have any questions for you. I just, keep up the great work.
Thank you, Commissioner. And we, like I said, we appreciate your consistent inquiries about the staff and your support of the staff. I think folks appreciate that, and we, from all the commissioners. So thank you very much. Appreciate it. Commissioner Crawley, thanks for your recent visit. We appreciate that as well.
Absolutely. It's always good to come out. Our neighbors that are differently abled hold a very special place in my heart. So I just want to say and echo what Commissioner O'Grady said, continue to do the good work. And I appreciate all that you all do, as well as the staff that you employ in taking care of those that are most vulnerable and their families. So thank you.
Thank you all very much.
Thank you, Jed, and thank you, commissioners. That concludes today's budget hearings. Our next budget hearings are scheduled for Thursday at 1 o'clock, where we'll be hearing from the Alcohol, Drug, and Mental Health Board, as well as the Commissioner's Health and Human Services panel. So thank you, everyone, today, and I look forward to seeing you on Thursday.
Thanks.